Hi, everyone. I'm so glad you're here because today we're talking about something that far too many men over 40 are struggling with silently, and it's affecting their confidence and their relationships and their quality of life. Now, if you're a man over 40, you've probably noticed some changes. Maybe you're not waking up with those strong morning erections anymore. Maybe things aren't happening as quickly or lasting as long. But what if I told you there's a simple science-backed 1-minute trick that could help improve blood flow, boost confidence, and get you feeling like your old self again, even better? This isn't some internet gimmick. This is rooted in what we know about how your body changes after 40 and how you can take control naturally and effectively. So let's break the stigma, talk facts, not myths, and get you back to feeling strong, confident, and rock solid. As men age, one of the most common challenges they face is a gradual decline in erectile quality, stamina, and overall sexual performance. While this is often dismissed as a normal part of aging, the root of the issue often lies in something very specific and manageable: reduced nitric oxide production. Nitric oxide, known as a molecule produced naturally in the body that plays a crucial role in vasodilation, the widening of blood vessels. This process is essential for achieving and maintaining an erection because it allows for increased blood flow to the penis during arousal. Without sufficient nitric oxide, even if testosterone levels are adequate and desire is present, the body simply cannot deliver the blood flow needed for a firm erection. For men over 40, nitric oxide levels tend to decrease significantly. This isn't just a sexual health issue, it's also a cardiovascular health concern because nitric oxide is critical for regulating blood pressure and overall circulation. The same arteries that supply blood to the penis are also responsible for heart health, so what affects one often reflects in the other. That's why the first step toward improving sexual performance naturally, without pills or invasive treatments, is to find ways to boost your nitric oxide levels through natural means. The most accessible and powerful way to do this is through nutrition. Foods high in dietary nitrates, like leafy greens, beets, arugula, celery, and spinach are excellent for boosting nitric oxide production. When you consume these foods, the nitrates are converted in your body into nitric oxide, which helps relax and dilate blood vessels. In fact, beetroot juice has been shown in several studies to improve blood flow, reduce blood pressure, and enhance exercise performance, which all translate to improved erectile function. So, incorporating a daily serving of beet juice or raw leafy greens can make a noticeable difference within just a few weeks. Another important factor is the reduction of oxidative stress. Free radicals in the body can degrade nitric oxide, making it less effective. To combat this, a diet rich in antioxidants is essential. Colorful fruits and vegetables, especially those high in vitamin C, vitamin E, and polyphenols, help protect nitric oxide from breaking down. Berries, dark chocolate, citrus fruits, and green tea are all excellent sources. In addition to their antioxidant properties, many of these foods support endothelial function, the health of the inner lining of blood vessels, which is directly related to nitric oxide synthesis. Exercise is also a powerful nitric oxide booster. When you engage in moderate intensity exercise, such as brisk walking, cycling, or strength training, your body responds by increasing nitric oxide production to deliver more oxygen and nutrients to your muscles. Regular physical activity not only boosts blood flow in the moment, but also improves your body's long-term ability to produce nitric oxide more efficiently. This is particularly important for erectile health, as consistent blood flow is essential for tissue health and responsiveness during arousal. A sedentary lifestyle, on the other hand, contributes to poor circulation, endothelial dysfunction, and decreased sexual performance. Additionally, certain supplements can support nitric oxide levels, though they should be used wisely and ideally under the guidance of a healthcare provider. L-citrulline and L-arginine are two amino acids known to be precursors to nitric oxide production. L-citrulline, in particular, has shown promise in improving erection hardness in clinical trials, especially in men with mild erectile dysfunction. These supplements work by increasing the availability of raw materials the body needs to produce nitric oxide, thereby enhancing blood flow. However, it's important to note that supplements alone are not magic. They work best when combined with proper diet and exercise. Lifestyle factors such as stress, smoking, and alcohol intake also play a critical role in nitric oxide availability. Chronic stress elevates cortisol levels, which can interfere with nitric oxide production and blood flow. Smoking is particularly damaging as it not only reduces nitric oxide, but also harms the endothelial lining of blood vessels, making erections more difficult to achieve. Excessive alcohol intake similarly impairs circulation and nitric oxide signaling. Therefore, reducing stress through mindfulness, eliminating smoking, and moderating alcohol can all contribute to healthier blood flow and improve sexual function. Breathing practices can also have an indirect yet powerful effect on nitric oxide levels. Nasal breathing, especially deep, slow breathing through the nose rather than the mouth, has been shown to naturally stimulate nitric oxide production in the nasal cavity. This type of breathing activates the parasympathetic nervous system, which helps relax the body, reduce performance anxiety, and improve vascular function. Incorporating nasal breathing into your daily routine, especially before intimacy, may help prime your body for optimal blood flow and performance. Sleep also cannot be ignored. Poor sleep quality, especially in men over 40, is linked to lower nitric oxide levels, higher blood pressure, and increased risk of erectile dysfunction. During deep sleep, the body engages in repair processes that are essential for vascular health and hormonal balance. Lack of sleep impairs both testosterone production and nitric oxide synthesis, creating a double hit to sexual performance. Prioritizing 7 to 8 hours of quality sleep per night is one of the most foundational steps toward better blood flow and improved erectile health. Pelvic floor exercises, often referred to as Kegel exercises, are a powerful yet underrated tool for men over 40 who want to improve their sexual health and maintain strong, lasting erections. The pelvic floor muscles play a crucial role in supporting the bladder, bowel, and sexual organs, including the penis. Over time, these muscles can weaken due to aging, lack of exercise, or other lifestyle factors, which directly impacts erectile function and overall sexual performance. When the pelvic floor muscles are strong and well conditioned, they help maintain firmness in the penis by preventing blood from flowing out too quickly during an erection. This is essential because an erection is all about trapping blood inside the pineal chambers long enough to sustain firmness. If the pelvic floor is weak, the blood can leak out prematurely, leading to softer erections and difficulty maintaining them. Strengthening these muscles through targeted exercises can improve the rigidity and duration of erections significantly. For men over 40, pelvic floor exercises become even more important because the natural decline in testosterone and vascular health can make it harder to achieve the same level of erectile function as in younger years. By focusing on these exercises, men can compensate for some of the physiological changes that come with age, essentially training their bodies to work more efficiently and effectively. The key is consistency and correct technique, which is why many men may not see results initially if they don't perform the exercises properly or regularly. To begin, it's important to identify the pelvic floor muscles correctly. One way to find them is by trying to stop the flow of urine midstream. Those are the muscles you want to target. However, it's not recommended to perform exercises while actually urinating because it can cause other issues. Once identified, the goal is to contract and lift these muscles as if you are trying to hold in gas or prevent passing stool. The contraction should be strong but controlled without tightening the abdomen, thighs, or buttocks. A typical pelvic floor exercise routine involves contracting the muscles for about 5 seconds, then relaxing for 5 seconds, and repeating this cycle 10 to 15 times per session. Doing 3 sessions a day can lead to noticeable improvements within a few weeks. Over time, as strength improves, the duration of each contraction can be increased to 10 seconds. It's also helpful to practice quick contractions, squeezing and releasing rapidly to improve muscle responsiveness during sexual activity. One of the benefits of pelvic floor exercises is that they are discreet and can be done almost anywhere without special equipment. This makes it easier to incorporate them into daily routines, such as while sitting at a desk watching TV or even during a commute. Regular practice not only enhances erectile function, but also improves bladder control, reduces the risk of premature ejaculation, and can even assist with recovery after prostate surgery. Scientific studies support the effectiveness of pelvic floor exercises in treating erectile dysfunction, especially for men over 40. Research has shown that men who commit to regular pelvic floor training experience significant improvements in erection quality, hardness, and sexual satisfaction. These exercises increase blood flow to the pelvic region by improving muscle tone and promoting better venous occlusion, which is the trapping of blood inside the penis during arousal. Better muscle tone also helps with nerve signaling, which is essential for achieving and sustaining erections. Additionally, pelvic floor exercises can reduce performance anxiety by giving men a sense of control over their sexual function. Many men experience anxiety because they fear losing their erection or not satisfying their partner. Knowing they're actively strengthening the muscles that contribute to erections can boost confidence, which itself has a positive impact on sexual performance. This creates a positive feedback loop where increased confidence further enhances erectile function. It's worth noting that pelvic floor exercises should be combined with other lifestyle changes for optimal results. This includes maintaining a healthy weight, engaging in cardiovascular exercise, managing stress, and following a balanced diet rich in nutrients that support vascular health. When combined, these strategies create an environment where the pelvic floor muscles and the entire vascular system can function at their best. While the benefits of pelvic floor exercises are clear, some men may find it challenging to get started or to stay consistent. This is often due to a lack of understanding of the exercises, difficulty locating the correct muscles, or simply forgetting to practice regularly. To overcome these hurdles, some men find it helpful to use apps, reminders, or work with a pelvic floor therapist who can provide guidance and feedback. Biofeedback devices are also available, which use sensors to help men visualize and improve their pelvic floor contractions. For men who have more severe erectile dysfunction or underlying medical conditions, pelvic floor exercises can still be part of a comprehensive treatment plan. They are often recommended alongside other therapies such as medication, counseling, or lifestyle interventions. However, even in these cases, strengthening the pelvic floor muscles offers a non-invasive, drug-free way to enhance sexual function and overall well-being. In addition to erectile function, a strong pelvic floor supports prostate health, which becomes increasingly important as men age. The muscles help regulate urinary flow and can reduce symptoms related to prostate enlargement or inflammation. Therefore, pelvic floor exercises not only benefit sexual performance, but also contribute to better urinary health and comfort. In summary, pelvic floor exercises are a simple, accessible, and highly effective way for men over 40 to improve erection strength and duration. They work by enhancing the muscles that support blood retention in the penis, improving blood flow, and boosting nerve function. When done correctly and consistently, these exercises can transform sexual health and confidence, making them a cornerstone of natural erectile function support. In today's digital age, many men over 40 struggle with the impact of excessive porn consumption and the resulting dopamine overload on their sexual health. While pornography itself is not inherently harmful, frequent and habitual use can disrupt the natural balance of the brain's reward system, leading to diminished sexual desire, difficulty achieving or maintaining erections, and reduced satisfaction during real-life intimacy. Understanding the connection between porn use, dopamine, and sexual performance is crucial for men seeking to reclaim their vitality and confidence. Dopamine is a neurotransmitter that plays a central role in motivation, pleasure, and reward. When you engage in activities that feel good, whether eating, socializing, or sexual activity, dopamine levels rise in the brain, reinforcing those behaviors. Pornography consumption can cause powerful surges of dopamine, sometimes far beyond what occurs during natural sexual experiences. This flood of dopamine creates an artificial high, training the brain to crave increasingly intense or novel stimuli to achieve the same level of excitement. Over time, the brain's reward system can become desensitized to these constant dopamine spikes. This means that everyday experiences, including real-life sex with a partner, may feel less stimulating or rewarding by comparison. This desensitization can manifest as decreased libido, difficulty becoming aroused, or erectile dysfunction. In essence, the brain becomes wired to respond more readily to the rapid-fire stimulation of porn rather than the slower, more subtle cues involved in real sexual encounters. For men over 40, this issue can be particularly challenging because natural physiological changes like declining testosterone and reduced blood flow may already make sexual performance more difficult. Adding dopamine desensitization into the mix can create a frustrating cycle where desire and performance continue to decline. Many men are unaware that their porn consumption is playing a role, or they feel embarrassed to talk about it, which only prolongs the problem. Breaking free from this cycle starts with awareness and intentional behavior change. The first step is to recognize and acknowledge the impact of pornography on your sexual health and mental state. Reducing or eliminating porn use allows the brain's reward pathways to reset gradually. It's often called dopamine detox or porn reboot, involves abstaining from all forms of pornography and masturbation for a set period, ranging from a few weeks to several months, depending on individual needs. During this reset period, the brain begins to regain sensitivity to natural dopamine triggers, making real-life intimacy more exciting and rewarding again. Many men report improved erections, increased libido, and stronger emotional connections with their partners after committing to this practice. It's important to understand that this is not an overnight fix. Patience and consistency are key, as the brain needs time to heal from the overstimulation. In addition to abstaining from porn, developing healthier habits that promote natural dopamine balance can speed recovery and improve overall sexual health. Regular physical activity is one of the most effective ways to boost dopamine naturally. Exercise releases endorphins and other neurotransmitters that improve mood and motivation, helping to counteract the sluggishness and low drive that can accompany dopamine overload. Mindfulness practices and stress management also play a crucial role. Chronic stress elevates cortisol levels, which can interfere with dopamine production and contribute to sexual dysfunction. Techniques like meditation, deep breathing, and yoga help reduce stress and restore balance to the nervous system. This calming effect not only supports dopamine regulation, but also reduces performance anxiety, which is often a barrier to satisfying sexual experiences. Nutrition should not be overlooked in this process. Certain nutrients support dopamine production and receptor sensitivity. For example, foods rich in tyrosine, an amino acid precursor to dopamine, such as almonds, bananas, eggs, and chicken, can help replenish dopamine stores. Antioxidant-rich foods combat oxidative stress, which can damage brain cells and interfere with neurotransmitter function. Staying hydrated and avoiding excessive alcohol or recreational drugs further protects the delicate balance of brain chemistry. Another critical aspect of overcoming dopamine overload related to pornography is rebuilding intimacy and connection with your partner. Real sexual relationships involve emotional bonding, communication, and physical closeness, which trigger a different, healthier pattern of dopamine release compared to isolated porn consumption. Spending quality time together, engaging in non-sexual physical touch like hugging or holding hands, and openly discussing desires and boundaries all contribute to a more fulfilling and rewarding sexual experience. It's important to recognize that withdrawal from porn can come with challenges, including mood swings, irritability, and temporary decreases in sexual desire. These symptoms are part of the brain's adjustment process and should not be discouraging. Support from partners, friends, or even professional therapists specializing in sexual health can make this transition easier and more sustainable. Technology and social media also play a significant role in dopamine overload. Constant notifications, social media scrolling, and exposure to hyper-stimulating content train the brain to seek quick rewards, making it harder to enjoy slower, more meaningful experiences like sex. Limiting screen time, especially before bedtime, and creating digital boundaries can improve overall brain health and sexual function. Ultimately, overcoming the negative effects of porn and dopamine overload is about restoring balance, balancing stimulation with rest, artificial rewards with natural ones, and isolation with genuine connection. For men over 40, this balance is essential to maintaining not just sexual health, but overall well-being and vitality. The journey requires commitment, self-compassion, and a willingness to make intentional changes in lifestyle and mindset. Sleep and testosterone health are two of the most crucial yet often overlooked factors when it comes to maintaining optimal sexual performance in men over 40. Quality sleep is essential for the body's repair processes, hormonal balance, and overall well-being. While testosterone is the primary male sex hormone that influences libido, energy levels, muscle mass, and erectile function, understanding how these two elements interact and how to prioritize them can make a significant difference in restoring and sustaining sexual health. As men age, the natural production of testosterone gradually declines, typically beginning around the age of 30 and continuing at a rate of about 1% per year. This decline can contribute to reduced sexual desire, difficulty achieving erections, decreased energy, and changes in mood. While some testosterone decline is inevitable, poor sleep habits can accelerate this process and amplify its negative effects. Sleep deprivation or fragmented sleep impairs the body's ability to produce testosterone efficiently, leading to lower levels than what might be expected for a man's age. Testosterone production primarily occurs during deep REM sleep, particularly in the early hours of the night. When a man doesn't get enough high-quality sleep, the duration of REM sleep shortens, directly affecting the nightly surge of testosterone. Studies have shown that men who consistently get less than 6 hours of sleep per night can experience a significant drop in testosterone levels, sometimes by as much as 15 to 25%. This reduction not only impacts sexual function, but also overall vitality, including muscle strength, cognitive performance, and mood regulation. Sleep quality also influences the body's ability to manage stress hormones like cortisol. Elevated cortisol, often caused by chronic sleep deprivation, can interfere with testosterone production and disrupt the balance of other hormones essential for sexual function. High cortisol levels are linked to increased anxiety, fatigue, and decreased libido, creating a cycle that further degrades sleep quality and testosterone levels. This interplay highlights the importance of managing stress as part of a holistic approach to sexual health. In addition to hormonal effects, poor sleep contributes to other health conditions that negatively impact erectile function. Sleep apnea, a common disorder in men over 40, causes interrupted breathing during sleep, leading to oxygen deprivation and poor cardiovascular health. Because erections rely heavily on healthy blood flow, any condition that impairs cardiovascular function, like sleep apnea, can result in erectile dysfunction. Treating sleep apnea through lifestyle changes or medical intervention often leads to marked improvements in erectile performance. To prioritize sleep for sexual health, establishing a consistent sleep routine is essential. Going to bed and waking up at the same time every day helps regulate the body's internal clock or circadian rhythm, which controls hormone release and sleep quality. Creating a relaxing pre-sleep environment free from electronic devices, bright lights, and stimulating activities can also enhance the ability to fall asleep quickly and achieve restorative deep sleep. Limiting exposure to blue light from screens is particularly important, as it suppresses the production of melatonin, the hormone responsible for regulating sleep-wake cycles. Using blue light filters on devices in the evening or avoiding screens altogether an hour before bedtime can improve melatonin levels and promote better sleep quality. Nutrition also plays a role in supporting sleep and testosterone. Health diets rich in healthy fats, such as omega-3 fatty acids found in fish, nuts, and seeds, provide the building blocks for hormone synthesis. Vitamins and minerals like zinc, magnesium, and vitamin D are also critical for testosterone production and regulation. Deficiencies in these nutrients are common in men over 40 and can contribute to low testosterone and poor sleep. Physical activity, especially aerobic exercise and resistance training, enhances sleep quality and boosts testosterone levels. Regular exercise helps regulate circadian rhythms, reduce stress, and improve cardiovascular health, all of which support healthy erections. However, intense exercise close to bedtime can have the opposite effect by stimulating the nervous system, so timing workouts earlier in the day is advisable. Avoiding substances that disrupt sleep and hormone balance is equally important. Excessive alcohol consumption can fragment sleep cycles and reduce testosterone production. Similarly, smoking negatively impacts circulation and hormone levels, further compounding sexual dysfunction in aging men. For men struggling with persistent sleep issues or suspected hormone imbalances, consulting a healthcare professional is critical. Sleep studies can diagnose conditions like sleep apnea, while blood tests can assess testosterone levels and other relevant hormones. In some cases, testosterone replacement therapy may be recommended, but this should only be pursued under medical supervision to avoid potential risks and side effects. Mind-body practices such as meditation, yoga, and breathing exercises can also promote relaxation and improve sleep quality. By reducing anxiety and calming the nervous system, these techniques support hormonal balance and overall sexual health. Incorporating these habits into a daily routine complements other lifestyle changes aimed at restoring vitality. It's important to understand that improving sleep and testosterone health is a gradual process. Consistency and patience are essential, as it may take several weeks or months of dedicated effort to see noticeable improvements in libido, energy, and erectile function. Monitoring progress through journaling or tracking sleep patterns can help identify what strategies work best for each individual. Ultimately, prioritizing quality sleep and maintaining healthy testosterone levels form the foundation for robust sexual health in men over 40. These two elements influence not only sexual performance, but also mental clarity, physical strength, and emotional well-being. By making informed lifestyle choices and seeking professional guidance when needed, men can take control of their sexual health and enjoy a more satisfying, confident, intimate life. Breathwork is a powerful and often overlooked tool that can significantly enhance sexual performance for men over 40, especially when it comes to managing anxiety and improving control during intimacy. Anxiety around sexual performance is a common challenge, and it can create a vicious cycle where worry about maintaining an erection actually makes it harder to do so. By learning to control the breath, men can calm their nervous systems, reduce stress hormones, and create the ideal physical and mental state for strong, lasting erections. When the body perceives stress, exercise, it activates the sympathetic nervous system, the fight or flight response triggering increased heart rate, muscle tension, and the release of adrenaline and cortisol. While this response is critical in emergency situations, it is counterproductive during sexual activity. Sexual arousal and erection require activation of the parasympathetic nervous system, the rest and digest mode, which promotes relaxation, blood flow, and the release of nitric oxide, the key molecule responsible for vasodilation in the penis. Many men unknowingly breathe shallowly or hold their breath when feeling anxious or under pressure, which maintains the body in a stressed state and prevents full relaxation. This shallow breathing limits oxygen intake and increases carbon dioxide levels in the blood, which can contribute to feelings of panic, dizziness, and muscle tension. Learning to engage in slow, deep, diaphragmatic breathing can reverse these effects, shifting the body into parasympathetic dominance and improving physiological conditions necessary for erection. One simple yet effective breathwork technique involves inhaling slowly through the nose for a count of 4, holding the breath for a count of 4, exhaling gently through the mouth for a count of 6, and then pausing briefly before repeating. This pattern encourages a longer exhale than inhale, which stimulates the vagus nerve, a major nerve that helps activate the parasympathetic nervous system. Over time, practicing this technique can lower baseline heart rate, reduce blood pressure, and decrease stress hormone levels, all of which contribute to better sexual function. Breathwork can be particularly useful just before or during intimacy to manage performance anxiety. Taking a minute or two to focus on controlled breathing helps clear distracting thoughts and brings attention back to the present moment, enhancing connection and pleasure. It also prevents the body from slipping into a fight or flight response when pressure builds, allowing erections to develop and be sustained naturally. In addition to its effects on anxiety, Breathwork improves overall oxygenation of tissues. Enhanced oxygen delivery means better stamina, quicker recovery, and improved muscle function, including the muscles involved in sustaining an erection. This increased oxygen availability also supports nitric oxide production, which is essential for vascular health and penile blood flow. Many traditional practices, such as yoga and meditation, incorporate breath control techniques because of their profound effects on both mind and body. Incorporating these into a daily routine can build resilience against stress, enhance mood, and promote better sexual health. Even brief daily sessions of focused breathing can accumulate benefits, making it easier to remain calm and centered when it matters most. Men over 40 often face additional stressors, from work pressure to family responsibilities, that can exacerbate anxiety and negatively impact sexual performance. Breathwork offers a portable, drug-free solution that can be practiced anywhere without special equipment. It empowers men to take immediate control of their physiological state rather than relying on external aids or medications. Combining breathwork with other relaxation strategies such as progressive muscle relaxation or guided imagery can further amplify its benefits. Progressive muscle relaxation involves tensing and then releasing muscle groups sequentially, which complements deep breathing by reducing physical tension. Guided imagery uses mental visualization of calming or positive if scenarios, reinforcing a relaxed state and increasing confidence. It's important to approach breathwork with patience and consistency. Like any skill, effective breath control improves with regular practice. Initially, men might notice that their breath is shallow or irregular, especially during moments of stress. By dedicating time each day to mindful breathing exercises, they can retrain their nervous systems to respond differently to pressure, improving their ability to perform under stress. For those struggling with severe anxiety or erectile dysfunction, breathwork can be integrated into a broader treatment plan that may include therapy, counseling, or medical interventions. However, breath control remains a foundational tool that enhances all other approaches by improving mental clarity and physiological readiness. Another advantage of breathwork is its positive impact on sleep quality. Since sleep and sexual health are closely linked, better rest can indirectly boost sexual function by supporting hormone regulation and reducing fatigue. Breath-focused practices before bedtime help calm the mind and prepare the body for restorative sleep. Incorporating breathwork into pre-sex rituals can create a psychological cue that signals the body to relax and become sexually responsive. This 1-minute trick can be as simple as taking slow, deep breaths together with your partner, fostering intimacy and mutual calm. Synchronizing breath with a partner also promotes emotional connection, which is a key component of satisfying sexual experiences. Overall, breathwork offers a natural, accessible, and effective way for men over 40 to overcome the mental and physical barriers to sexual performance. By harnessing the power of the breath, men can reduce anxiety, improve blood flow, and enhance their confidence, leading to more satisfying and lasting erections. Nutrition plays a fundamental role in supporting sexual health for men over 40, and making targeted dietary choices can dramatically improve erectile function, energy levels, and overall vitality. As men age, the body's metabolism slows down, hormone production changes, and cardiovascular health can decline, all factors that influence sexual performance. Eating nutrient-dense foods that support vascular health, hormone balance, and energy production is a key strategy to maintaining rock-hard erections and lasting stamina. One of the most important aspects of nutrition for sexual health is supporting healthy blood flow. Erections depend on the ability of blood vessels to dilate and deliver oxygen, rich blood to the penile tissues. Diets high in saturated fats, trans fats, and refined sugars can contribute to atherosclerosis, the buildup of plaque in arteries, leading to poor circulation and erectile dysfunction. Conversely, foods that promote vascular health and improve nitric oxide production can enhance blood flow and erection quality. Leafy green vegetables like spinach, kale, and arugula are rich in nitrates, which the body converts into nitric oxide. Nitric oxide is a powerful vacillator that relaxes blood vessels and improves circulation, directly benefiting erectile function. Studies have shown that men who consume diets high in nitrate-rich vegetables experience better endothelial function, the lining of blood vessels, and improved sexual performance. Other key foods include beets, which are also high in dietary nitrates, and citrus fruits, which provide vitamin C and antioxidants that protect blood vessels from damage. Berries like blueberries and strawberries are rich in flavonoids, plant compounds that improve circulation and reduce inflammation. Consuming a variety of these fruits and vegetables daily supports a healthy cardiovascular system and reduces oxidative stress, both critical for maintaining strong erections. Healthy fats are another essential component. Omega-3 fatty acids found in fatty fish such as salmon, mackerel, and sardines improve heart health by lowering triglycerides, reducing blood pressure, and decreasing inflammation. These fats help maintain flexible, clear arteries that can efficiently deliver blood to all organs, including the penis. Additionally, nuts like walnuts and almonds provide beneficial fats along with L-arginine, an amino acid that supports nitric oxide production. Protein sources that support muscle mass and hormone balance are important as well. Lean meats, poultry, eggs, and plant-based proteins like legumes and quinoa provide the building blocks for testosterone synthesis and muscle repair. Maintaining muscle mass through adequate protein intake is linked to higher testosterone levels, which in turn support libido and erectile function. Certain vitamins and minerals are crucial for sexual health and hormone production. Zinc, for example, plays a central role in testosterone metabolism. Deficiency in zinc is common among men over 40 and can lead to lower testosterone levels and impaired sexual function. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Magnesium is another vital mineral that helps relax blood vessels and improve sleep quality, both essential for sexual health. Leafy greens, nuts, seeds, and whole grains are good sources of magnesium. Vitamin D also deserves special attention. It is involved in hormone regulation and cardiovascular health, and many men over 40 are deficient due to less sun exposure and decreased skin synthesis. Low vitamin D levels have been linked to erectile dysfunction and low testosterone. Supplementation or safe sun exposure can help maintain adequate levels, supporting both sexual and overall health. Hydration is often overlooked but is equally important. Dehydration reduces blood volume and can lead to poor circulation, fatigue, and reduced sexual performance. Drinking sufficient water throughout the day keeps blood flowing optimally and supports the delivery of nutrients to tissues. Conversely, men should limit foods and substances that impair sexual function. Excessive alcohol consumption disrupts hormone balance, dehydrates the body, and impairs nitric oxide production, all of which contribute to erectile difficulties. Processed foods high in sugar and unhealthy fats promote inflammation and vascular damage, making it harder to maintain erections. Smoking is another major factor that restricts blood flow and damages blood vessels, significantly increasing the risk of erectile dysfunction. In addition to choosing the right foods, timing and meal composition can impact energy levels and sexual health. Eating balanced meals with a mix of protein, healthy fats, and complex carbohydrates stabilizes blood sugar and prevents energy crashes that can dampen libido. Avoiding heavy, greasy meals before sexual activity can prevent sluggishness and promote alertness. Supplements may also provide additional support, especially for men who struggle to meet their nutritional needs through diet alone. Popular supplements for sexual health include L-arginine, which enhances nitric oxide production, Tribulus terrestris, a plant extract traditionally used to boost libido, and maca root, known for improving stamina and sexual desire. However, it's important to approach supplements with caution and consult a healthcare professional to ensure safety and effectiveness. Integrating these nutritional strategies into daily life not only improves sexual function, but also promotes overall health, including weight management, cardiovascular fitness, and mental clarity. Men who prioritize a nutrient-rich diet often report better mood, increased energy, and greater confidence, all factors that contribute to satisfying sexual relationships. Developing a personalized nutrition plan tailored to individual preferences, health conditions, and lifestyle can maximize results. So working with a nutritionist or healthcare provider can help identify potential deficiencies, food sensitivities, or dietary imbalances that may be affecting sexual health. Small, sustainable changes in eating habits can lead to significant long-term improvements in erectile function and sexual vitality. In conclusion, nutrition is a cornerstone of sexual health for men over 40, influencing blood flow, hormone levels, energy, and overall well-being. By focusing on nutrient-dense, whole foods that support vascular and hormonal health, men can naturally enhance their ability to achieve and maintain rock-hard erections and enjoy fulfilling intimate experiences.